conditions. And that definitely was a little helmet-to-helmet on that hit.
On the sideline, the whole time it seemed like two Vontez perfect, and yeah.
A concussion is a mild traumatic brain injury that results from a bump, jolt, or blow to the head. Athletes may suffer a concussion as a result of direct contact or a whiplash type injury. The brain is the most fragile organ in the body with a similar texture and consistency as jello. The skull provides a hard protective shell around the brain, while a watery substance known as cerebrospinal fluid located in the subarachnoid space helps to cushion the brain. Cerebrospinal fluid protects the brain against impacts with the wall of the skull during everyday head motions. It is this cushioning provided by cerebrospinal fluid that helps to protect the billions of neurons located inside the brain. Each neuron communicates with other neurons through chemical and electrical signals that travel down long thread-like extensions called axons. Sustaining a hard blow to the head and neck region can cause the brain to strike the inside of the skull. During the impact, the brain compresses against the inside of the skull, sending shock waves throughout the brain. These shock waves can tear or stretch the axons of some of the brain's neurons. This trauma is called diffuse axonal injury, or axonal shearing. Damaged axons can impair normal brain function by interrupting communications between the neurons. Depending on where the brain is injured, physical symptoms of a concussion often vary. Symptoms of a concussion may include headache, nausea, dizziness, poor muscle coordination, light sensitivity, blurred vision, ringing in the ears, slurred speech, and loss of consciousness. Affected individuals may also experience disorientation, confusion, memory loss, inability to focus and concentrate, irritability, and depression. When an athlete sustains a forceful impact injury to the head or neck region, it is imperative that they are immediately assessed by a team trainer or physician.
Let's say you're an NFL player who just delivered or received a helmet-to-helmet blow. With the help of personnel, the NFL has a system in place to help identify when a player may have sustained a concussion.
The NFL's concussion protocol can be triggered by some obvious and some not so obvious personnel. The team medical staff or unaffiliated medical staff in the red hats on the sideline. 2 athletic trainer spotters and 1 unaffiliated neurotrauma consultant up in the booth. Game officials, or even a coach, another player, or the injured player himself.
The camera tends to follow the ball, right? So wherever the ball goes, that's where a lot of the times the camera, but somewhere we hope in the broadcast feed there's going to be a picture that shows us exactly what's happening to that player both before and after that hit. It is mandatory that every single concussion evaluation has to have the injury video reviewed by both the UNC, the unaffiliated doc, and the team physician.
Every player who undergoes a sideline concussion evaluation enters the blue medical tent.
So if we want to examine a player and we want to bring them in the tent, someone will literally just come over, grab the tent, pull it up, voila.
That's quick.
And now we can go in. And basically what you can see is that we've now
It's already
created a medical exam room.
and a little quieter.
completely quieter, and also we've eliminated all the visual distractions, right? There's not scoreboards that are flashing and plays that are going on. So if I need to do a concussion exam, I really need you to focus and concentrate. I'm going to examine your eyes and do some things where I need you really to lock in visually, and so that really is facilitated by being inside here.
After a player is thought to have a concussion, the medical staff check to see if the athlete is having any of the no-go symptoms. These are signs that the player cannot return to the game no matter what. These include loss of consciousness, confusion, or amnesia. If the player does not have any of these symptoms, they are taken to the blue tent, where they are examined by the team's physician and the UNC, which is the unaffiliated neurological consultant. They then ask a series of standardized assessment of concussion questions. These include, what month is it? What day is it? What day of the week is it? What year is it? And what time is it right now? Then, they ask the athlete the Maddox questions, which are, where are we? What quarter is it? Who scored the last points? Who did we play last? And did we win the last game? If deemed necessary, they then perform more tests, which include a memory test where they repeat random words the medical staff say, and then ask the player to repeat everything he can remember 5 minutes later. More tests they can perform if they need are cervical spine exams, evaluation of speech, observation of gait, and eye movement.
Diagnosing a concussion comes in multiple steps. It starts on the sideline, then transfers to the emergency room, and further a visit with physicians. Once an athlete has suffered an impact to the head on the field, they are assessed on the sideline by trainers. If the athlete doesn't pass the sideline procedures, they are taken to the emergency room. In the ER, concussion specialists perform a three-step process. First, a verbal interview is performed with the specialist, asking the patient questions about information prior to the head impact to test retrograde amnesia. Next, the patient is asked if they remain conscious immediately after the impact as another scale of severity. Lastly, in the interview stage, the specialist asks questions about events post-impact and determines how much post-traumatic amnesia the patient is suffering from. Post-traumatic amnesia results are the best prognosis for concussions. In the second step of the process, the specialist examines the SCAT-2 form of the patient, a form that is used to standardize the severity of the patient's concussion and helps the specialist assess the degree of the concussion that the patient is suffering from. The SCAT-2 test inquiries about symptoms, memory, attention, balance, coordination, and events in the game. The last phase of the three-step process is neurological examination. In this third and final phase, neurologists and neuropsychologists test strength, reflexes, sensations, cranial nerve function, and mental status of the patient. This examination gives the doctors a very specific prognosis on the patient's concussion and helps them prescribe a recovery program based off the grade of concussion suffered by the patient.
With repeated concussions or repeated traumatic brain injuries, one can develop chronic traumatic encephalopathy, or CTE. Formerly termed dementia pugilistica in boxers, CTE is a deteriorating brain disease associated with repeated blows to the head, resulting in additive loss in brain matter. CTE can result from mild traumatic brain injuries or blows and does not require diagnosed concussions.
Don't worry, Marv, I'll get him for you.
With repeated impacts to the head, the brain inside the skull ricochets back and forth. It goes forward, accelerates and decelerates, but it also goes rotationally. And that causes the brain inside the skull to actually elongate and stretch. And that stretching puts a lot of physical force on the individual nerve cells, especially the neurons and the axons. And that can lead to the buildup of tau. Tau is a normal protein in the brain, and normally it's inside the nerve cell, and it contributes to what we call the cytoskeleton, or the skeleton of the cell. It helps hold up the cell shape. Under abnormal circumstances, like after trauma, when the nerve cells are damaged, the tau actually comes off off the skeleton. It comes off the microtubules and it starts clumping up, and eventually it'll kill the cell if enough builds up over time. An individual in his 40s, this is a former NFL player who is a person of large stature. You can see that the ventricles, the areas of the brain that contain spinal fluid, they're enlarged. This thinning gets to be damaged more than the ventral aspect, and that's something we've really only seen in CTE. We can see spaces near the hippocampus, which is a part of the brain that's important for learning and for memory, and we can see that there's been shrinkage there as well. To see this in such a young individual is quite startling. We see a lot of CTE lesions on the top and the lateral sides of the frontal lobes, which is about 2/3 of the forward part of the brain. That's what leads to the symptoms and signs of CTE.
Current work is being done to identify cerebrospinal fluid biomarkers that may indicate CTE in living patients. Aggregation of hyperphosphorylated tau protein in the brain can indicate repeated blows to the head and is correlated to CTE and other deteriorating brain diseases. At the moment, the only conclusive diagnostic evidence of CTE results from post-mortem examination of the brain. Some symptoms include, but aren't limited to, confusion, aggression, depression, memory loss, speaking impairments, disorientation, cognition deficits, and impaired judgment.
Once the patient has been diagnosed, the only treatment for a concussion is to rest and avoid activities that increase the patient's symptoms. However, this tends to differ from person to person. Experts have found that some people recover from their symptoms at different rates, which means that medical professionals don't have a specific step-by-step process to follow. Although they do differ, most severe concussions will require a longer rest time. This means it is ultimately up to the physician to decide when it is safe for the athlete to return to play. Since CTE is not diagnosed until after death, medical professionals usually treat the different symptoms individually in an attempt to increase the patient's quality of life. These could include pharmaceutical and therapeutic behavioral management, pain relief, speech therapy, and memory exercises. Coaches and athletes are reducing risk of injury and future disease by preventing the number of repeated blows to the head during practice and during games. Some of the methods include the use of tackle wheels to teach young football players to use correct form and prevent head-to-head collisions, the use of robotic tackling dummies, and increasing the effectiveness of protective equipment.